Allison's resource binder. The first flap is for therapeutic exercises, resistance bands. I have this section due to needing to give clients a home exercise program, and these will make it easy to give them ones that are appropriate. I'm trying to make it so that you can see a little bit better. I don't know if it's working. And so forth. There are several different types of programs that are here, and depending on the client's needs. And of course, the location to where they're going after. Some specific for hands, some specific for those with Parkinson's, those with hemiplegia, and again, some hand exercises. The next flap is tip sheets. These are the sheets that tell clients about their diabetic management as far as what they can eat, and with the resources. Here's an article that was found interesting with some parts highlighted, letting the client know this is specifically what I was researching, why this is good for you. This is on recovering from a stroke, little tips that the client should know about getting back out there into life and completing all their activities of daily living. This one is about hand dressing. Dressing. Some tips about different items that they may have to wear. This is about hope safety after rehabilitation. So it gives them just an idea of what to look for, what is not safe, so that they have an idea. It gives them a little check mark so that they can determine if it is in fact safe. This one is toys for children with disability. I also have in here tips for caregiver life balance. Here's some pictures so that for those who need to learn some ADL skills. These are some sheets with some pictures so that it makes it a little easier for learning. Trying to go slow enough so I don't make you dizzy. This is just showing them how to get out of bed depending on, in the rehab or hospital, they'll have this type of bed. But at home, if they have it or if they don't have it, it kind of gives them an idea of how to get out of bed utilizing the appropriate area that they have, because they don't all have the same. These are protocols as far as certain surgeries. This one is for reverse total shoulder arthroplasty protocol, which is becoming quite obvious. Becoming quite common. However, it is important for us to note that we will use whatever the doctor says. But these are just some that I've had from other clients in the past. Also, these is some protocols and exercises for those who've had a reverse total shoulder replacement. But like I said before, the doctor's protocol is what will be followed. And it gives you a breakdown by month, what you should be able to do, what exercises they should be able to do. In the next tab, it's functional assessments. And so we start off with the FIMS, even though I know that is going away. It's always good to have an idea of how to grade those. The Bartel, which is being used more and more now. And again, it shows all the areas that it takes care of, that it assesses. This is just a nice little sheet that you can put the score in the beginning, then at discharge, and you can also have on the sheet their goals that you were hoping to get them to. Just a good way to keep track of. And again, this is just the rating scale. It's so that it's easier to look at when it's time to grade. Okay, so this one is the mobility care items. This is from the GGG. So this is how we grade them. Shows you the item, the definition of what it means. And over here, we put what they were on admission, their goal, and them at discharge. Okay, these are their grading scales that are used for muscle MMT. Okay, and alongside it just lets you know about range of motion and what each kind of means. Okay, this is GG codes for activities of daily living. So it lets you know, again, admission, their goal, their discharge, their items, what they are, what's the definition of them, so that you're aware of it. And I'm just trying to make it a little easier without making anybody dizzy. So on the back, this just tells you how to score it so that you know. So again, you can use either or. Bartel, you can use GGGs, you can use the FIMS, depending on, again, the facility and what they require. Okay, the next form is the balance assessment. This is important just to know how well their fall risk. So we have the modified clinical test of scenario, interaction, and balance, just to see how their balance is going. We have the timed up and go test, the tug test, which can help to determine the balance. The 6-minute walk test, which can help to, again, assess balance. The single leg stance test, and it also shows the stair climbing test, and they have single step test, and it kind of gives you the norms. The kin to this is that you will of course use what the facility uses. This is the fall assessment. These are modified fall efficacy scale. Again, this is very important. You help give them this, and it'll have them tell you how confident the person is in doing these particular task. The functional reach test, which, as you can see in the picture above, just to see how well they can reach, and it'll determine if they will have low balance. This is the modified clinical test of sensor interaction, and this is the interpretation of the test results, just so that you have an idea of what each means after you've given the test. And this is a fall assessment that was from Johns Hopkins tool for home health. I use this because I do work in home health now. It just lets me know how, a fall risk is what the company that I work uses. Their fall risk, how high of a risk they are. Okay. I just have the PNF due to I will be working a lot with stroke patients, so I find that these patterns are very important to know. It helps me to evaluate their different tasks. I do have a tab for developmental. It has the reflexes and when they're supposed to go away. Also, I have developmental milestones so that I know, at this age, this is what the client is supposed to be doing, and so forth. And again, here also, this is precautions. So these are very important. I have cardiac external precautions. I have breathing and coughing precautions that are important to know. It's how to use the incentive spirometer. I've noticed in care of my clients that a lot of them don't remember how to use it. These are how they can do activities of daily living after heart surgery. A lot of times they may try to do a little bit more than they should at the time, and this pamphlet just kind of helps them to know, oh hey, I'm supposed to be taking care of myself. I want to be independent, but I do also want to be on the safe side. So this is more just on different things after having heart surgery. This is helpful because it just gives them something to take home with them. This is how to protect your chest after heart surgery. These are hip precautions, so they'll have, the listing. It also lets you know how they should lie down, how they should get up, so forth. I also have back precautions because there are a lot of back surgeries that do go along. Then I just have what I call Fieldwork Guide 1 and 2. It's just from Kaiser, letting me know what we're required. I just thought this would be helpful for fieldwork. Also, Fieldwork Guide 2, which is the fieldwork manual, also would be helpful, a quick reference for when I'm in the clinical setting. And I do have one more tab, which is just a source of OT resources that can be used. This is specifically for my site, but also just in general. Thank you so much.